Did you know that 80% of women have some form of pelvic floor dysfunction? Since this is so common, I want to provide you with the top 10 signs of pelvic floor dysfunction. Hi, I'm Dr. Melissa, pelvic floor physical therapist at Revitalize Physical Therapy. Stick with me until the end of this video, and we're going to provide you with a free quiz to see how healthy your pelvic floor really is. So let's jump in. We're going to talk about the first 6 initial signs of pelvic floor dysfunction. We're going to bundle these 6 together because they all involve some form of bladder or bowel function, which is a topic that we often do not openly discuss. To understand why the signs occur, we need to talk about the anatomy of your pelvic floor first. The pelvic floor is home to 3 organs: your bladder, uterus, and rectum. This is supported by a vast amount of muscles, ligaments, and connective tissue. If you have weak or tight muscles surrounding the organs, or if you have a birth trauma or surgery that has limited the mobility of the pelvic system, and or if you have weakness or difficulty managing pressure from up above in your abdominal region, that's going to put extra pressure on the pelvic floor. All of these impairments can lead to pelvic floor dysfunction. Let's take a look at a list of these signs. The first sign, constipation or hemorrhoids. The second sign, fecal incontinence. The third sign, difficulty holding back gas. The fourth sign, urine leakage. The fifth sign, frequent or intense urge to use the bathroom. And the last sign, a sensation of incomplete emptying, either your bladder or bowel. The 7th sign of pelvic floor dysfunction is a feeling of pressure or heaviness onto the pelvic floor. This can also be known as prolapse. Prolapse is when one or more of the organs presses into the vagina or extends out of the vagina. There are 3 different types. It can be bladder, uterine, or rectal. Most commonly, this occurs because the pelvic organs do not have enough support from the pelvic system below. The 8th sign, pelvic pain. This can be quite global, but some examples are pain with a pelvic exam, pain with intercourse, or pain during tampon insertion. Pain is typically related to overactivity of the pelvic floor or tension of your muscles. Pain can also be difficult to pinpoint because the muscles and connective tissues are kind of all encompassed in the pelvic floor. The muscles extend up top here and go all the way back to the tailbone in this back region. The 9th sign, unresolved hip or back pain. Since the pelvic floor attaches to all the aspects of the pelvis, extends up into the tailbone or coccyx, and then into the sacrum, it has a major impact on the stability of the spine. That's when you can start to notice some low back pain, but it can be stemming from down below in the pelvic floor due to the connections and relationship. You may also have lingering hip pain. This could be due to a muscle that sits inside of the pelvic floor called the obturator internus. A lot of times this is not addressed if you're just looking at the outside of the hip. Sometimes you need to go into the pelvic floor to really release this muscle. Last but not least, the 10th and final sign, unconfirmed UTIs. You've gone into your doctor and you have a negative urine culture test, or you've been on antibiotics that aren't resolving your symptoms. It may be time to talk to your provider to see if your pelvic floor is part of the cause. Pelvic floor activity can mimic signs of a UTI, and those symptoms would be urinary urgency, urinary frequency, or pain. So let's recap. This is a list of the top 10 signs of pelvic floor dysfunction. 1. Constipation or hemorrhoids. 2. Fecal incontinence. 3. Difficulty holding back gas. 4. Urinary leakage. 5. A frequent or intense urge to use the bathroom, either bladder or bowel. 6. A sensation of incomplete emptying, either bladder or bowel. 7. Pelvic pressure or heaviness. 8. Pelvic pain. 9. Unresolved hip or low back pain. And 10. Unconfirmed UTIs. If you are interested in knowing how healthy your pelvic floor really is, click the link below and take the quiz. Also, if you're interested in learning my 3 favorite stretches for your pelvic floor, click the link above. Let us know in the comments if you have found this video helpful. If you like the video, make sure you hit the like button and subscribe. We'll be posting more videos like this often.